All right, so today I got a leader in our field, not just our field, a leader in biomechanics, Dr. Christopher Powers. He's been doing this for a long time and published a lot of ACL papers and actually help a lot of basketball, football, soccer player return to play from ACL. And he had been doing this for like the whole biomechanics thing for a long time, which a lot of pro sport are just starting to do it. Uh, Dr. Powers, can you like introduce yourself a little bit?
Yeah, thanks for having me on, Eric. I am a professor at the University of Southern California. I'm in the Division of Biokinesiology and Physical Therapy. I'm also the owner of the Movement Performance Institute, which is a clinical lab and physical therapy clinic in El Segundo, California.
Nice, nice, nice. Um, I want to share like the reason I want to have you on. Obviously, like everybody knows, like hockey, uh, NHL, NBA, even NFL are started to like explore this biomechanics lab, motion capture, three-dimensional, three axial force plate. Um, and you've been doing this for a long time. So I reached out to you, went to your lab to see like your assessment process, which really amazed me. Like how so me and my mentor, we were at Louisville, University of Louisville. We are like one of the first to build a biomechanics lab for college basketball. So we are one of the first to do that in college basketball. But like as you know, like I'm working with Denver right now, so we are starting to explore this. And I just feel like uh you guys been doing this for a long time. You have a lot of experience in doing the biomechanic testing. So I went there to like see how it goes and it really amazed me. So how about you start by uh sharing like how do you come up with like the testing for the ACL and the knee?
Well, I think where you have to start. So let me back up for a second. So the reason I do biomechanical testing on athletes, two reasons. One, a lot of athletes are recovering from injury and or surgery, and I want to make sure that they are, you know, the rehab process is complete. They're ready to return to the field or the court, and biomechanically they're sound and moving well. We know that a lot of the injuries that we see, especially the overuse injuries, have biomechanical origins. So they're biomechanical tendencies that really create excessive stress and strain on different parts of the body, tendons, ligaments, joints, etc. And so we also use biomechanical testing to look for certain risk factors for injury as well, with the idea that that information could help inform strength and conditioning, rehab, injury prevention, et cetera. But it all starts with understanding what the biomechanical risk factors are for certain injuries. We know for ACL injury, for example, there are certain biomechanical signatures that we think are put people at risk for injury. For patellar tendinopathy, there's certain movement traits there are for Achilles tendinopathy, et cetera. So really, it all starts with understanding what you're looking for, and really using biomechanics as a tool, really. And where I think a lot of people get in trouble is they just go in to do biomechanical testing without a hypothesis, not a reason for doing it. They're just collecting masses of data with no clear direction, and it's very easy to get lost in the minutia. So really, when we do biomechanical testing for athletes, we're looking at the injury history. We're really focusing in on, okay, what do we need? What information we need to help this athlete recover or prevent a future injury? So, but I would say it's all hypothesis driven, you know. So, depending on what they're coming in for, there's certain things I know I'm looking for.
Nice, nice. Uh, so another thing that kind of what I learned or what I learned when I visit you guys is during like change of direction or like deceleration, obviously uh the most amount of force they put into the ground is not the last step, but the penultimate step or pre-penultimate steps. So it's like one step away or two step away. But uh when you say like that's not the most important thing, why is that? Why is that not?
Well, you have to look at, if you ever have looked at anyone tearing their ACL, for example, it's not the penultimate step where it happens. It's the terminal step where it happens. So it may be true that there's higher load on those steps, but really you have to look at how that final step is achieved, and the mechanics of that. So it's not necessarily the magnitude of load. The magnitude of load is important, but also how that load is applied to a joint that is moving or decelerating is also very important. So it's the interaction of the kinematics, the motion, plus the force that really creates the injury. And you just can't look at the force. You have to look at what the leg is doing. Is the foot rotated? How is the athlete decelerating? Are they using their sagittal plane muscles like they should, or are they turning the foot in to decelerate with more frontal or transverse plane loads? So you're right. It may not be the highest load step, but when you combine that with the strategy used to decelerate and stop the body center mass, combined with that load, then that's the injury what's going to happen. So really, that's why we look at that you know where they have to decelerate and change the direction. That's a critical point in the movement cycle. So and and that's where the injury occurs. So that's why
Yeah.
we look at it. So
So before I dive in like further into like the testing, talk to me about uh the injury mechanism for ACL tear.
well, I mean, I won't. We're still in terms of the actual mechanism. It's really a multi-planar, multifactorial issue. I think we still don't. I don't think we can really hang our hat on, oh, it's this variable that causes ACL tear. And it's really a combination of loading in the sagittal plane, the frontal plane, the transverse plane, I think, that really comes together to maximize the strain on the ACL. So for example, movement strategies where there's high quadriceps force demand creates the anterior shear. When you combine that with tibiofemoral rotation, which puts a lot of stress on the ACL in the transverse plane, and then maybe some frontal plane motion, knee valgus, for example. When you combine stress and strain in multiple planes, that's where we think the ACL gets maximal strain. But there's hyperextension injuries, there is deceleration injuries. There's lots of different potential mechanisms that have been described. But really, the research shows that there are certain variables that have shown to be predictive of future ACL injury. High ground reaction forces, high knee moments, high valgus angles and moments, all have been shown in prospective studies to predict future injury. But I think when we evaluate an athlete's risk for ACL injury, we're not looking for just one thing. We're looking for a general movement profile that we think puts athletes at risk. And how's the trunk? Is the trunk stable? Is the hip stable? Is the knee collapsing in? Do they use the dominant the knee strategy, which puts a lot of high anterior shear force on the knee? So really, that's kind of how we look at it. So we're really looking at a constellation of variables. not just one or two.
Mm. So, uh, are you able to share like your testing battery for the ACL?
Well, we also look at multiple movements as well. I don't think we can just look at one movement and for risks. So I know like a drop jump is probably the most studied, most commonly used, which I think is informative. But a drop jump involves landing on both legs. And most ACL injuries occur when you're decelerating or changing direction on one leg. So we use the drop jump, we use a lateral movement, lateral shuffle, a deceleration where you sprint up, plant in reverse direction. We do a cutting maneuver 90 degrees. Um, we do look at single limb hopping and jumping as well, triple jump for looking at that. So we actually look at 6 different tests with multiple movements. So we're really looking at how the athlete handles a wide range of biomechanical demands. And, um, and I think that's important as opposed to just, okay, we're just going to do a single limb squat or a drop jump. But I think, you need to look at the bigger picture.
And so I'm gonna dive deeper into this because when I was there, what fascinated me is most of like most I mean I work with college basketball before and now as you know I'm pro. Like almost everyone I know in the performance world, when we do drop jump, we ask them to uh we want to compare left versus right, right? Um, but like you already know like there's more and more research saying like when it comes to ACL return to play, a symmetry is probably like drop jump using drop jump to compare asymmetry, even like leg extension, left versus right is not like the best metric we should look at. So, talk to me about your thoughts on like, just letting the injury limb or the affected limb land on the force plate.
Yeah, I know everyone likes symmetry measures. And that you're making a couple of assumptions there. First, you're assuming that the non-injured leg is biomechanically a good leg. Okay, which may be the case, maybe not the case. But here, the issue is jumping on a force plate. If you're using force platforms, for example, looking at loading symmetry, all that does is tell you, yes, there's a difference side to side. It doesn't tell you where the difference is coming from. An athlete can favor one side over the other or generate comparable power on one leg compared to another leg with a totally different strategy, you know. So, just the force plate testing on both legs just tells you, yes, there's a symmetry problem, but it doesn't tell you where the deficit is coming from. It could be the ankle, it could be the knee, it could be the hip. And so from a rehab standpoint or a injury prevention standpoint, you have to understand where the symmetry is coming from, the asymmetry is coming from, and really target the strength and conditioning program or the rehab program appropriately. But I think the force plate testing is a good screening tool to, okay, so the athlete has asymmetry. Um, but it doesn't really inform you in terms of, okay, what am I going to do about it? How do I correct that asymmetry?
Mm.
Strength, strength testing falls into the same kind of issue. Um, Less so for the quad, but we do a lot of hip testing, hip strength testing, hip extensors, hip abductors, because research has shown that those are really important muscle groups for hip and knee stability. The reason we don't like to compare right strength to left strength is the fact that you're assuming that the uninjured limb is normal strength. And you could mask weakness if you have weakness bilaterally, which a lot of athletes do, especially at the hip. So yes, you could have a strength symmetry, but be below normal for your strength or power. So it's tricky, and I think you have to be very careful about using symmetry measures as an indicator of optimal function, in my opinion. So quad strength is a little different. Quad strength, athletes' quads tend to be strong bilaterally regardless. So we do symmetry on the quad strength, especially in the post-surgical patients, but we don't do it as much. We don't do it at all really for the hip strength.
Um, let's let's dive a little bit deeper into this. Um, I like the idea that you said the non-ninja leg is sometimes not the one that is better. And I don't know, coming from a track background, from like working with track athletes, jumpers, triple jump, even pole vault, sometimes the injured leg is probably compensating for the other leg, and they are probably fatigued, so they're injured. Do you kind of see that in uh team sport or like the rehab cases?
Yeah, exactly. Yeah. A lot of athletes develop asymmetry just due to the nature of their sport. You know, I mean, we see a lot in soccer, for example. So the plant leg versus the kicking leg, there could be strength differences there. Um, I just I saw a I just saw a pole vaulter this week in the clinic, and there's a lot of asymmetry. When he goes to take off, he plants his left leg and then goes upward. So his left leg was much stronger than the right leg, in terms of the muscular development and power. But but that was a leg that was injured because all that load is going through that plant leg. So Um, if I would have compared that strength to his non-injured side, I mean, that side could actually be stronger than the non-injured side. So you got to look at it within the context of the injury, the sport they're playing, and you just can't go blindly into just trusting those numbers and assuming, okay, that's the issue, therefore I think it does help inform. We look at the biomechanics as well as the multiple formats together to tell the complete story. But I don't think you can look at them really independently and really get the complete picture.
Mm. Talk to me about like triple hop. Because obviously, like in the past few years, there's uh some sort of debate about like the triple hop testing. Share me your thoughts on the triple hop.
Yeah, I mean, I have to say that most of the athletes we test score well on triple hop symmetry for distance or for time or whatever. But biomechanically, it doesn't look good. You know, I'm all about, you know, the quality of the movement, just as opposed to how far you can jump. So when you're doing a triple hop, how well do you absorb the impact? Are you stable? Is your trunk flying all over the place? Can you stick the land? Um, so yes, I think the distance gives you an idea of what the total leg power is and that sort of thing, but it doesn't inform you in terms of the quality of the movement. And really, you can perform it well distance wise, but be a mess biomechanically speaking.
Mm. And uh another thing that I really, 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 really enjoy because I thought like personally I like that, but I thought like a lot of people in performance world like don't value that type of testing is gait assessment. And when I saw it, I was like, yeah, I love this like right away. So talk to me about your thoughts on gait assessment.
Well, to be honest with you, most most athletes do a lot of running. I mean, I mean, in the NBA, you run up and down the court.
Yeah.
You do more running than you do jumping during the NBA game. How you sprint up and down the court tells you a lot about the load. I think a gait analysis is just as valuable, if not more valuable, than doing a drop jump or a triple jump or whatever. Because that tells you a lot in terms of how they're able to handle shock absorption, how stable they are on one leg. So I think that needs to be part of the arsenal of the biomechanical testing, and that's not done clearly. Most teams are just doing jumping tasks, maybe a little bit lateral movement, but I think running is really essential. Soccer, football, basketball, maybe less so in volleyball and other types of sports, but um, I think a lot of overuse injuries, Achilles and calf injuries, um, quad tendinopathies, patellar tendinopathies, are more related to running than they are of the other movements. So
Mm,
that's just my bias, but a lot of good information can be gained. But I think people shy away from it because they don't quite know what to look at or how to do it. It takes some time, it takes some expertise, it takes some knowledge, and if it's easy to shy away from something that you're not familiar with.
mm. Nice, nice. So, uh, obviously you've been doing this for a long time, and you kind of share like the testing you do for the knee. Um, from a performance coach standpoint or from a practitioner standpoint, like, uh, do you think we should uh what's the word I'm looking for? Do you think we should like do specific tests for specific type of injury? Because I don't know about like past 10 years, but like the last 2 years, the last 3 to 4 years when I work with like elite like elite athletic department, like we basically do the same testing all day long. Share me your thoughts.
Yeah, that's a really good question. So when an athlete comes to see me, I take a history of their injury history and why they're here. And depending on the injury, I'm looking for different things. And I may be doing different tasks or different movements to get the information I need to figure out what's going on. Um, when an athlete says, I get pain when I'm jumping and landing or doing a certain movement, we'll analyze that. But depending on if it's a foot and ankle problem or a knee problem or a hip or low back problem, I'm looking at different things. I'm looking at different variables based on what we know about injury mechanisms. It's different if you have a low back issue versus a knee issue versus a foot and ankle issue. It's all different. And so I tailor the evaluation based on what's creating what I suspect is creating the problem. And then from a biomechanical variable standpoint, I'm looking at everything. So I would evaluate a knee patient very different from a low back pain patient from a foot and ankle patient,
Mm,
just based on what variables I'm focusing in on,
mm,
and probably what activities I'm assessing as well. But
mm,
you're right. I mean, just I think from an ease and simplicity standpoint, we just okay, you got 15 athletes, we're just going to do the same battery of tests. Um, and maybe it's informative for some, but not very useful for others. So I think the biomechanical testing needs to be tailored to the specific athlete based on their injury history. and what they're dealing with. And as you know, every player you know is dealing with something or has in the past. So, I tend to stay away from the performance side. As a physical therapist, I feel my job is to optimize the athlete's biomechanics so that when they get to you as a strength and conditioning, you can exploit those good biomechanics. But as you know, you start loading up someone with bad mechanics, that doesn't go very well. So
Mm.
so it's almost like my job is to prepare them for you.
Yeah.
So so you're ready to go. And really now you can start really getting them ready to maximize their performance. But think of what biomechanics is more the corrective side of things.
Mm, mm.
So here's a thought. So, the season just ends and okay, everyone's been dealing with injuries all year. So the first couple months you work on the corrective stuff. So by the time they report to camp in the fall, you know, they're ready to go. They shouldn't be dealing with nagging injuries going into, you know, camp, and that just sets the stage for what's going to happen for the rest of the season. And now staff is just managing the injury. So
Yeah. Yeah.
just my thought on where it fits. But I my job is to make players available, and now what makes someone jump higher, run faster, shoot more threes, who knows? You know what I mean? You know as much as I do. All I know is injury and what biomechanical factors may be contributory and what to do about it. But to me, that's 80% of the battle. is
Yeah.
is
Yeah.
really, you know, how much vertical jump can you get, in an off season, and how much is that really going to impact the player's
Yeah.
performance throughout the year? I mean, who knows? But if you can keep them healthy for a season, you know what I mean? 82 games. Now you're talking, you know.
Yeah. Yeah.
So that's just my philosophy on it.
I totally agree with you. So talk because I think everybody's trying to figure out like how to use it in basketball. And I know there are people out there want to do this shooting biomechanics. Talk to me about your thoughts on like that shooting biomechanics.
You know what, I have no comment because I'm not an expert on it. I I don't know. What makes someone a good shooter? I I have no idea, but I'll leave that up to people that know that area better than I do. Like I said, I'm more of an injury person, not a performance
Yeah.
person.
Yeah.
So I'm sure there's good shooters in NBA with really bad mechanics that we look at and go, boy, that doesn't look good, but they sure go in the
Yeah.
buckets, you
Yeah.
know. What makes Steph Curry such a great shooter? Who knows? I mean,
Yeah.
but
That is true.
but I think the tendency is, especially this is a big deal in the running community, is they look at the elite sprinter and they think everyone should do it like that person does because they're the best in the world. And I don't know if I buy that because everyone's different, everyone's body type is different, their anthropometrics are different, their mechanics are different. So what works well for one athlete doesn't work necessarily well for all athletes. So yeah, the performance side is really tricky, and I prefer to stay away from it because I stay in my lane.
Yeah. Yeah. All right. Uh, you brought up injury mechanism, which is a big topic in, I don't know, last 5 years. And my mentor, Adam Petway, he published like injury ACL injury mechanism in the NBA and Achilles tendon injury mechanism in the NBA. Like Achilles tendon easy fall step. ACL there's pro hop, there's I think there's change of direction, and there's a contact. So yeah, it's good to know the injury mechanism. But the other thing is like we probably can't change that. So what are like just from your experience, like what are the value for like understanding the injury mechanism since we're probably not going to be able to change that.
Yeah, I would disagree with that. I would say that you can change the mechanics. If you can't change it, then we're wasting our time. 100%. We shouldn't even be collecting it. But I believe that you can change the mechanics, and you got to first develop the muscle performance capacity to move differently, and train people to use their muscles different, to do things differently. We do it every day in the clinic, whether it's a runner or a volleyball player or soccer or basketball. We're really working on the mechanical side of things. Look, I think performance coaches would argue I can change a sprinter's mechanics. I can change a basketball shooting mechanics. I can change the mechanics in a baseball pitcher. I assume that's the case, and I can change people's mechanics. It takes time. It takes a lot of practice, and but my entire business is based on be able to change that. Otherwise, the injury persists. And as you know, most of the overuse injuries in the NBA are very chronic. They're persistent, and the mechanics are always there. So I think you can do it. I've
Mm,
seen it through my experience, and
yeah.
whether it's jumping, whatever. So, and I think the research shows that if, especially on the ACL side, these programs that have been developed to prevent ACL injury, especially in soccer, have been shown to be effective. You know, so they got to be doing something.
Nice, nice. I love this. I love this. So, uh, last part of this podcast, I obviously we talk in your office before, but still, um, you work with a lot of athletes, a lot of elite athletes. You work with like different teams. I know you consult from different teams, consult for different teams. Um, and pro sport entering this new era. What do you think? I know you already said this before, but like, what do you think we can get out of this, like collecting biomechanics data?
That's a tough question. My thought is always biomechanics is a tool, and you should use that tool to answer a specific question. And if you don't have a question, you shouldn't be using the tool. And from my standpoint, and otherwise you're just collecting data for data collection's sake. And I think that's where a lot of people are struggling is that they're collecting all this data. They don't know quite what to do with it. They don't know what to make out of it and how to implement it and how to use it. And it's tricky, it's especially on a mass scale, like what's happening in the NBA. It takes time to develop a strategy to really incorporate those data into strength and conditioning, injury prevention, rehab, and that sort of thing. But you got to go into it with a reason and a hypothesis. You know, like in the research world, we do research to answer a question. And I think what's happening is a lot of data being collected without a question. And people are scrambling, going backwards to figure out what to do with it. So there's a lot of manpower, a lot of energy being put into it with a lot of spinning wheels. But those of us, I've been doing biomechanics research for 30 years, and looking at injuries. And this is relatively new, especially in the NBA, just the last year or two. So to me, it's like, oh boy, all the teams are collecting all this data. I suppose there's a bigger reason to do this. I'm sure the data is being collated centrally and will be looked at some point to look at profiles or injury risk patterns or whatever they're looking at. But uh, it's going to take a long time to figure out whether it's. In the meantime, the team should be capitalizing on using this information to their own benefit, in terms of helping specific players with specific needs. Um, whether or not that's happening or not, I don't know, but um, that would be the ideal now that you have the tools available. But you need the expertise to kind of help guide, you know, how to do it and what to look at.
Mm, mm. Um, I was talking to one of your student. She's currently the applied biomechanist at Miami Marlin, Tyler Goldston, and
Uh-huh.
she mentioned one thing that's really interesting is like collecting these biomechanics data. Oh, like the reason why I collect it is obviously like to make some changes to correct their movement, like you said. But if you collect the data and trying to do it without understanding motor learning, you're missing a piece. So talk to me about, share me your thoughts on this.
Yeah, I mean, it's a myth that all you got to do is get stronger and your mechanics will change. That's not the case, and just making the athlete stronger isn't going to change their mechanics. Maybe they jump a little higher, maybe they get off the ground a little quicker. Great, but from an injury standpoint, that's not the case. So um, really, it's a two-stage process. You have to build the capacity, the multiple forms capacity, which I'm a huge fan of. And then you got to teach the athletes how to use that capacity in some way or form. And it doesn't have to be a dramatic change. Most athletes rely very heavily on their quadriceps, for example, for everything. To decelerate, to accelerate, change direction. A lot of athletes don't use their hips well, to me, that's a big weak spot. And just teach an athlete how to engage their hip muscles more to decelerate, change direction is a huge win. Um, but you got to have the muscle performance in those key muscle groups first. Otherwise, athlete will default to what gets them there the fastest. Um, so yeah, motor learning is a huge part of this process. Is really patterning. Use golfing as an example. Golf is a sport where technique and the swing is so critical, and they really they're at the range hitting thousands of balls to ingrain that motor pattern into their brain. And it's very similar in our field. You really have to repetition and practice different movement strategies to ultimately change the 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 pattern, which I think can occur. There's evidence to suggest that it can. So
Nice, nice. And I'm glad you brought up this because obviously as a strength coach, all we want to do is get our athlete bigger, stronger. And we used to think that that's gonna cure everything. That's gonna cure the cancer. But like obviously like if you look back in the past 10 years, like that's not the case. We're getting athletes bigger, stronger, faster, but we're dealing with more and more injury. So
yeah,
uh
well, that's what happens. You apply more force to bad mechanics. What do you think is going to happen? That's exactly it. And I that could be one of the reasons why injuries, they're not going down, they're getting worse. And we're just creating, yeah, stronger athletes, and they're just applying that load more repetitively, but also probably not optimally.
mm, mm,
So that that kind of makes sense to me. You know.
yeah, yeah. Uh last part of this podcast, I want to ask you, um, although you already explained it a little bit, but like if I ask you or if a team asks you like we already do like jump, we already do counter movement jump, we already do all type of testing with our athlete on the force plate, on the commercial force plate. Like what are the value to do that with the camera system? What are the value to do like let's say change of direction test with the camera system?
Well, as I said earlier, the force plate just tells you the force you're imparting to the ground. And there's multiple different ways you can apply the same force with different strategies. And what the kinematics tell you is how the athlete is performing that task. And the ground reaction force is the result. And you got to look at how it's occurring. And you know, you could have a big deficit, as I mentioned earlier, side to side, could be from the hip, could be the knee, could be from the calf, who knows? But it doesn't tell you where it's coming from. So the kinematics and the kinetics give you insight into where the deficit would be, by looking at the moments, the angles, and that helps you direct you to fixing the problem to correct the asymmetry. So the way I look at it, the force plate testing is a screening tool. Okay, it tells you, all right, we have a problem here. We have an asymmetry. All right, so that athlete needs a deeper evaluation to figure out where that's coming from. And that's where you incorporate more of the full biomechanical testing, the compare the ankle power on the right versus the left, the knee power on the right versus the left, the hip right and left to determine where that deficit is coming from. So that's how I would apply it. But that takes time. It takes some expertise. You know what I mean? You gotta know what you're looking at. It's much easier to jump on a force plate and oh, here's the printout, and oh, here's the asymmetry. You got this much less power on this side. Great. To me, that is not very helpful for me as a physical therapist in terms of directing an intervention program.
Nice, nice. Um, all right, that's all the question I have for you today. Obviously, you consult, you work for different teams, and I do feel like we are entering this new world. As a performance coach, we are entering this new world, and there's a lot of things, I think a lot of stuff as a performance coach, as like organization, we probably should reach out to you guys. So if anyone's interested in what we're talking about today, where can they reach out to you? Where can they find you?
Oh yeah, you can just drop me an email. My USC email is powers@usc.edu. My clinical facility is Movement Performance Institute. So movementpi.com. Check out the website. And yeah, and if you're ever in town, stop by. Eric, it was good to have you come, and it was great to chat and show you kind of a little bit of what we do. And hopefully you found it useful.
Nice, nice.
Yep.